I founded GetzWell's Pediatrics, San Francisco's first integrative pediatric practice, in January of 2008, with the belief that an integrative approach to pediatric care, which combines the best of conventional and alternative medicine, is the wisest approach to health optimization and the treatment of illness in children. At GetzWell, we practice individualized medicine, which means there's not a one-size-fits-all approach to the treatment of illness, to the advice that we give parents on the many topics we delve into, or to the vaccines that we recommend for children. Prior to founding GetzWell, I worked in hospital-based clinics for 10 years, and we vaccinated kids like crazy. I figure I've been witness to, given, or supervised the vaccination of over 150,000 vaccines in the last 12 years. While I've never seen an immediate adverse outcome, as I delved more deeply into integrative and functional medicine, I began to question the conventional vaccine schedule and whether there was a saner, healthier, and alternative way of vaccinating children. Because, to be very clear, in general, I believe in childhood vaccination, which is why at GetzWell's Pediatrics we provide individualized alternative vaccine schedules for almost all of our patients. And my discussion today will expand on the approach that we use at GetzWell. In my view, vaccines are one of the great public health successes of the 20th century, and I believe in the importance of childhood vaccination, but I don't think that it has to happen on the schedule that's been determined and mandated by the CDC and the American Academy of Pediatrics. In the 21st century, we are seeing illnesses that Christine mentioned in far greater numbers than we've ever seen. And the current CDC-mandated immunization schedule may be contributing to these chronic diseases. So in my practice, we've taken a 21st century approach which involves individualizing or personalizing medicine, which includes the personalizing of a vaccine schedule for all patients. There's incontrovertible evidence that vaccines have saved millions of lives and do work to protect us from diseases. So in my view, the debate that has raged for the last decade or more, the all vaccine or no vaccine debate, as I call it, I don't think is really relevant, because today we have the tools and the wisdom to mitigate the actual or perceived risks that may exist with the vaccines. That being said, I do recognize generally that vaccines are not 100% risk-free or 100% effective, but on balance, based on many years' worth of scientifically validated data, I believe their benefits, particularly when coupled with mitigation steps that we like to use at GetzWell, far outweigh the risks of not vaccinating children. At GetzWell, we've adopted a middle ground, a thoughtful, personalized approach along with these tools, the details of which I'll expand on later in this 15-minute talk. I'm going to take a step back and give an example of a recent vaccine that has been highly successful. PCV7 it is called, and it works to protect against strep pneumococcus, or shorthand strep pneumo, which is a bacterium that even during my residency was responsible for hundreds of thousands of annual cases of invasive disease. And invasive disease is defined as meningitis, pneumonia, and blood infection, and 40,000 deaths in the U.S. annually. Today, strep pneumo invasive disease is rarely seen, and so during residency training, we read about it in textbooks, but we don't actually have, we don't see it. The vaccine was developed and began to be used in 2001, and between 2001 and 2005, invasive pneumococcal disease decreased by greater than 100,000 cases. Additionally, the vaccine addressed problems of antibiotic resistance by preventing infections by strains of strep pneumo that don't respond readily to antibiotics. And we all know that antibiotic resistance is a huge problem in healthcare today. Another success story is Haemophilus influenza type B, or Hib. Before the development of vaccine, Hib caused invasive disease in 1 of every 200 infants or young children, and was the most common cause of bacterial meningitis in kids. Significant risk of lifelong disability or death accompanied these Hib infections. And Hib is something that I did see during residency, and it's devastating. Polio is another example that we're all familiar with. I know, as a kid, I had a friend whose father was crippled because he'd had polio as a child before the advent of the vaccine. A colleague of mine who is a pediatric intensivist, pediatric intensive care unit doctor at Stanford, tells the story of several completely unvaccinated kids who recently died of chickenpox. This is an illness that many of us are familiar with, but we don't usually think of as being fatal. And I'm not saying that I'm necessarily pro-chickenpox vaccine, but it does point out that we can become cavalier or perhaps lulled into a sense of security because we don't see vaccine-preventable diseases in our communities very often. Frankly, I believe that the reason we're even able to have this discussion of how, whether, and when to vaccinate is because childhood immunization has been such a success in providing for the public health and in contributing to herd immunity. What used to be the usual childhood illnesses, whooping cough, measles, mumps, even polio, are confined to descriptions in textbooks. And for most of us physicians trained today, as I said, we don't see them. And as parents and caregivers, we don't see these things in our communities. We aren't touched by these diseases. As a result, in the U.S., we feel very safe and we feel protected from these illnesses, and we've begun to weigh the risks of catching them versus the perceived risks of the vaccines. I have seen these illnesses in developing countries where I've done medical work, and they're devastating. And I'm grateful that I don't have to see them, here, and hopefully never will. One major concern of many families is the potential for immune system dysfunction and neurologic damage, as Christine mentioned, from vaccination. This dysfunction might result in diseases that Christine mentioned, such as ADHD, asthma, allergies, skin disorders, celiac disease, and other autoimmune diseases like diabetes. All of these illnesses we are seeing more of in children today. However, I do not believe that for the vast majority of children that vaccines are the single cause of immune dysfunction. In most cases, it is likely multifactorial, and the trigger may even be loaded in the womb. For instance, we live in a very toxic world, more and more toxic world, and we are exposed even in utero to pesticides, plastics, bisphenol A, genetically modified food, medications including antibiotics and antidepressants, flame retardants, rocket fuel, DDT. In 2005, the Environmental Working Group did a study where they looked at the cord blood of 10 infants across the United States, and in all 10 samples, they discovered, on average, 200 different chemicals, including Teflon, plastics, phthalates, mercury, lead, and dioxins, and rocket fuel. Most of these chemicals are known to be cancer-causing, cause neurologic problems, decrease IQs, to lower birth weights. U.S. manufacturers produce more than 75,000 different chemicals, and only 10% of these have been fully vetted for public safety. Another factor that may influence immune function relates to the hygiene hypothesis, which states that because we live in an ultra-hygienic world, our immune systems aren't challenged and occupied in ways that they have been over the time frame of the evolution of the human species. So as Christine was explaining, the Th2 arm of our immune system kind of goes wonky, and it gets sort of hyper-excited because it's not balanced out by the Th1 arm of the immune system. And so our immune systems are, if you will, looking for ways to stay busy, and they begin to attack our own bodies. And we're seeing this more and more in our children in the form of, the various diseases that we mentioned. Vaccines obviously alter immunity, and, that's the point. We don't necessarily know who is the most vulnerable to the impact of these immune-altering factors, because we know that the vast majority of kids are doing fine with the vaccines.